Welcome to Motors and Medicine. On today's episode, I'm going to be discussing TBI, or traumatic brain injury. Now, to start, we have to have an understanding of what exactly a traumatic brain injury is. So, first off, a head injury without a concussion is considered a head contusion. So we don't want to confuse a TBI with just a head contusion. And a head contusion is any mild blow to the head or just a bump on the head. Okay, we'll call a head contusion something mild like that. But an actual TBI is considered more serious or pervasive because there has been a concussion involved. And a concussion and a TBI are sometimes synonymously used as far as the terms are concerned, but I'm going to get into what exactly the concussion is in just a moment. But it's important to note that a true TBI is an injury that can occur from any number of forceful causes. High velocity injuries, motor vehicle crashes, for example, getting hit in the head with something extremely, with enough force. Okay, we'll say that. Like getting hit in the head with a baseball, something like that, with enough velocity. Being tackled in football, taking a head injury like that. Falling down and hitting your head on something really hard. Those are all mechanisms of how these traumatic brain injuries can occur. Now here, the key, we need to separate the traumatic brain injuries. When we have these two different types of injuries, we have our traumatic brain injuries that are obviously concussion, and then we have those that are concussion, but there's been a loss of consciousness. So we have to separate the two. First, we're going to talk about traumatic brain injuries with concussion without loss of consciousness. Now, these are the types of injuries that are far more common, but these injuries you get from any, like I said, any of the number of examples that I listed, motor vehicle crashes, sports, getting hit in the head by flying objects, falling, these types of things. So a traumatic brain injury with a concussion without loss of consciousness can be serious. Typically, what we look for with these types of injuries are any type of neurological deficits. And I'm going to go over that in just a minute, but I just wanted to kind of get it clear that we have the traumatic brain injury with concussion without loss of consciousness on one hand. Now, on the other hand, we have a traumatic brain injury with concussion with a loss of consciousness. Now, when there is a loss of consciousness, typically we tend to worry about things a little bit more, because with that lapse of consciousness, the injury to the brain was severe enough that things could not continue to run upstairs, if you will, just to keep it really simple. And for that brief period of time, however that brief period of time may have been. Now, honestly, concussions with loss of consciousness can last anywhere from 30 seconds or just seconds in general to as long as 30 minutes or an hour. The longer the period of unconsciousness, the more we consider that the brain has been injured with a more significant trauma. Things that we look for when these types of injuries occur. If it's a very high velocity type of injury, especially from a clinician standpoint, we want to try to rule out the things that are more pressing or more profound. And those are things like hemorrhages in the brain, a subarachnoid hemorrhage, for example, or an epidural bleed. These injuries occur with high velocity. They typically are TBIs with loss of consciousness, and these injuries are very time sensitive. When these types of injuries occur, people have to get to the ER, to the hospital, as quick as possible, because these what we call arterial or fast bleed injuries can be very detrimental in a very short period of time, and they need to be dealt with very, very quickly whenever something like that occurs. Now, on the other hand, you can have a traumatic brain injury with a loss of consciousness, and it only be for a brief period of time, say 30 seconds or less. And that's still a significant injury to the brain, but we're less concerned about, say, quick arterial bleeds and maybe more concerned about slow bleeds that are venous. And an example would be a subdural bleed. And that's where it takes a few days for a subdural bleed to develop. So if somebody has been injured and they had a very brief lapse of consciousness, we do tend to check back with those people within a few days to make sure that things are not starting to develop as far as symptoms are concerned, or dysfunction has not set in to where things are not working properly. Whether it be a mental focus or some other motor or sensory deficit that has occurred, days after that injury, which would potentially indicate the presence of a subdural bleed or a slow bleed. So these are the two things that we try to differentiate when these head injuries occur. Anytime we have a head injury, we always have to try to take that very seriously. I know a lot of people, they get hit in the head and they may or may not have that loss of consciousness, but many times they do have a brief lapse of consciousness, and a lot of people will not consider that to be serious because they came to very quickly, they say they're fine, and really down low, they don't know if they've got other underlying issues like a subdural bleed that could develop a few days from now. And so it's always a good idea that if you have a head injury and you have suffered a loss of consciousness, even if it's brief, you always go to the hospital, you always go to the ER, you get checked out, because those things need to be ruled out. And typically a CT scan is done on the initial basis of that injury, and then potentially within a week or so after, just to make sure that bleeds are not developing. Obviously, if it's a higher velocity injury, like in a motor vehicle crash, for example, and we're dealing with a lapse of consciousness that is much longer, and then beyond that, we may or may not have a hemorrhage or an epidural bleed. Those things are dealt with almost immediately, because those things will definitely potentially kill you much faster. And so injuries like that, there is no time to mess around. Those injuries, you go straight to the hospital, straight to the ER. And so I thought it would be important to bring this up now, just because it's summertime. There's a lot of people going out, having fun, doing a lot of fun things, going out on motorcycles and ATVs and rock climbing and hiking and such. These head injuries are going to be happening on a more frequent basis, as well as people just recreating. And so even just a typical motor vehicle crash, there's going to be a lot more people out on the road during the summers. So I think it's something that people need to be aware of. Head injuries are very serious. TBIs especially. And when we're dealing with those that have lapses of consciousness, it's definitely a far more serious injury that we need to be cognizant of. Now, on the lighter side, if we're dealing with, say, these mild TBIs where there's not a loss of consciousness, but there was still a concussion, and that by definition is just an injury to the brain where there is a coup contra coup force that occurs. And what that means basically is the brain sits in the skull, suspended by these tissues. We call them meninges. And if the brain is swung forward and backward in a very fast motion from, say, a whiplash injury in a motor vehicle crash, or if you get hit in the head from playing football and your head is whipped back and then forward again, the brain inside is actually moving as well, and it's kind of making contact to the front and to the back. That's the coup contra coup injury that we see. And that type of injury happens with these traumatic brain injuries. Sometimes, like I said, that can lead to a loss of consciousness, and sometimes it does not. When it does not, the injuries are not as serious, but we still need to take note of the injury itself, be examined, make sure that there are no deficits to cranial nerve function, make sure that sensory and motor skills are still working, speech is working, focus, no visual disturbances, things like that. But of course, if an injury to the brain has occurred, there has been a lapse of consciousness, and we are more concerned about that potential for bleeding in the brain or a more profound injury, then of course those are the things that we need to be very cognizant of to get to the hospital and get those things checked out. So hopefully this information was helpful. I just want all of you out there to just be aware that these head injuries are very serious. You don't want to take them lightly, because these TBIs, the more they accumulate, let's say you get one TBI in a year, or maybe two TBIs or three, the more TBIs you get in any given year, or just in over a period of time, of any time, there are going to be some ramifications that are associated with that traumatic brain injury. And you may not notice it at first, but there will be some effects that start to happen down the road. So it is vital to keep track. If you do have a TBI, try to keep track of how many you incur over the course of time, just because these injuries over time, as we've seen with a lot of the National Football League players, these TBIs that are cumulative in their effects over time, they start to cause other injuries that are just considered very, very serious, from mental disorders to mood disorders to inabilities to function cognitively. And a lot of these people start to suffer from depression, anxiety, or even worse, they become suicidal. So head injuries are a very serious thing. So again, I hope this information was helpful, and I appreciate all your support. If you have not yet, please subscribe to the channel. It'll help the channel grow. And on the next video, we'll get back into the cars. We'll see what we're going to work on. Likely, I've got something else going on with the Bronco coming up here soon. So we'll get back into that. And then we'll just continue on. So until then, please hit the thumbs up button if you like the information. And until next time, this is Motors and Medicine signing off. Thanks a lot.